Santiago, and this is week 4 of our home month rotation. Today we are going to be discussing a little bit about bone healing, as our topic for our oral presentation this week was intrinsic factors of bone healing. So, bone healing. Bone healing requires immobilization and compression. Usually the optimal range for compression is 12 to 18 pounds per inch squared. The bone does regenerate back to 100% of its strength following a fracture. The body has difficult time healing the bone to full strength if it's greater than 1 centimeter apart, or if the gap is greater than the radius of the bone at that level. Some important terminology that we have to know is osteoblast deposits bone, while osteoclast reabsorbs bone. So there are stages of bone healing. You have to understand these stages overlap. So primary bone healing is usually bone that heals with no motion or no callus formation. So this is called an intramembranous healing. And the stages of that are inflammation, induction, and remodeling. Secondary bone healing is called endochondral ossification, and that secondary bone healing has micromotion, which causes callus formation in the bone. So, importantly, the stages of secondary bone healing do overlap. So you start with inflammation, which peaks at around 48 hours and subsides for about a week. So this is a normal inflammation of the body, and this is why there's new research, and many physicians are practicing now that they don't give NSAIDs early on during bone healing, because it has been shown to delay the inflammation portion of bone healing, since NSAIDs are used to decrease inflammation. So the edema, or the inflammation here, acts as a hydrostatic splint, which helps heal the bone. Secondly, we have induction, which is kind of broken down into soft callus formation and hard callus formation. Soft callus formation begins several days after injury and persists for about 1 to 2 months. A fibrous and cartilaginous tissue develops at each end of the bone. If the soft callus fails to unite the two sides of the fracture, as with an amputation or something, it will cease to grow and reabsorb. While in hard callus, that stage of bone healing, after the soft callus is successfully connected to the fracture, it begins to ossify, thus forming a hard callus, and this occurs around 3 to 4 months of bone healing. Then our last stage of bone healing is remodeling, which can last several years, and the excess callus is reabsorbed, and this is the final bone morphology determined by Wolff's Law. And Wolff's Law is bone will adapt to the loads under in which it is placed. So, like discussed here, there's 2 types of bone healing. There's a primary and secondary. So, in primary bone healing, bones healed by eversion remodeling. There's no callus formation, like stated, and requires good bone opposition and no motion at the fracture, this is the preferred method for bone healing, because there's no motion. Secondary bone healing, I believe, is more commonly seen, but it involves formation of a cartilaginous and fibrous tissue intermediate that are later replaced by bone, and this is what is termed callus formation. And this occurs due to the motion at the fracture or osteotomy site, and this is the less desirable method of bone healing, as it does take a little longer to heal that bone. Next, we're going to discuss bone complications. So most of the common ones we see are delayed non-unions, pseudoarthrosis, malunions. So malunions is a fracture that heals, but it's anatomically incorrect. So delayed unions are healing that has not advanced at an average rate of the specific location for an amount of time. So these are usually healed by strict immobilization. That's pretty much one of the only ways to heal a delayed non-union. A non-union is fracture or osteotomy that is a minimum of 9 months and has not shown radiographic progress for 3 months. So general interventions, including bone stimulators or operative means, are required to heal a non-union. Atrophic non-unions require a bone graft, though. Pseudoarthrosis is the end stage of a non-union. So it's a fibrocartilage surface develops at the bone fracture site, and a joint space develops that may contain synovial fluid. So for the treatment for pseudoarthrosis, operative intervention is the only reliable method for forming a union when pseudoarthrosis is involved. So like I stated, atrophic non-unions require a bone graft. Atrophic meaning that they are avascular. But yeah, there's different factors that can affect bone healing, such as smoking, diabetes, malnutrition, certain types of medication, like we stated with the NSAIDs, or even just the quality of your bone. We can go in depth into talking about bone growth stimulators, as they are bioelectrical principles that work in bone healing to cause a bone healing reaction. So there's different types. You have electrical bone stimulators, which have a direct current and they're invasive. You have electromagnetic bone stimulators, which are non-invasive. So they have things such as capacitive coupling, inductive coupling, your pulse electromagnetic field or combined magnetic field. You also have ultrasound bone stimulators, which are also termed under the category of non-invasive. And these are used to cause micromotion at the fracture site to sort of create or start the process of soft callus formation once again if the bone failed to do so or is hindered in some way during original bone healing. So these are the main things I wanted to talk about this week. Thank you so much, and I had a great month here. I learned a lot, so if you have any questions, please feel free to let me know. Thank you.